We come back home and talk matters of women. A women group in Kanifing East has chosen to support the nearest hospital with packs of sanitary materials in gesture, well appreciated by the Ministry of Women Affairs. The organization projected the slogan, "Charity begins at home." Aisha Tamba has details of that story.
Nyuni Nenla, a women association in Kanifing East with the aim to support the cost of women and children, has aligned its loyalty to Kanifing General Hospital in the fight against the COVID-19 global pandemic. The organization supported the health facilities with dozens of sanitary materials following a voluntary contribution of 50 of its members to enhance services to over 600,000 people who fall within the primary catchment areas of the second largest hospital in the country. Public Relations Officer of Nyuni Nenla Association, Aminata Jaite, said her group is very passionate about the health and hygiene of families across the country. She emphasized the power of women in unity, which she said are reasons of their support to the government at the most crucial time.
We put our heads and hands together and came up with a token amount to present to the hospital. Yes, this hospital is the Kanifing Hospital. It's a hospital that belongs to the entire Gambia. But we are taking ownership, by partaking in the activities that are such as we are going through today.
Sarah Golad Juve, president of the association, described their existence as a tributary to the soul of the Ministry of Women Affairs and that charity begins at home.
It from nowhere. So this Kanifing Hospital belongs to you people. It is our hospital. Before we balanga leka. So therefore, before we go anywhere, we are residents of this place. We all walk to come here. We don't need a taxi. So the hospital belongs to us. And I want you to know that the hospital belongs to us. And whenever you are in need, you come and say hello to us.
The Chief Executive Officer of Kanifing General Hospital, Keba Mane, thanked the Women Association, describing their support as valuable and necessary in the prevention of COVID-19.
Thank you in abundance for giving us these gifts that you provided to us towards the fight against COVID-19. This is in no small measure a laudable effort, and it will enhance our service delivery towards the fight against COVID-19. COVID-19 is a challenge globally, even for resource high countries or high income countries, more so our own Gambia, which is a low resource country. Therefore, it's a collective responsibility for all and sundry to put their hands on deck to fight against this very, very devastating disease.
The Minister for Women, Children and Social Welfare, Fatou Kinte, commented the role women in support to her ministry with understanding that the government cannot do it alone.
Yes, we are in the COVID-19 pandemic. It's a concern to everybody, more so the government of Gambia. And this is the reason why President Adam Barrow has established a cabinet subcommittee on COVID-19 under the chairmanship of the Vice President. I am a member because COVID-19 affects families, and families are under my ministry. So this makes my ministry very important in the fight against COVID-19. I want to say, as I have already been saying, that COVID-19 is here. It's not a joke. It is a reality, and it is deadly.
The hospital, formerly called Serekunda General Hospital, serves as a COVID-19 holding center in addition to its traditionally held services on the public on 24-hour basis. Management of the facility installed safety mechanisms in the form of testing signs of coronavirus on all entry points and hand-washing tradition on every meeting point within the hospital. Reporting for iAfrica News, I am Aissatou Tamba.